Greater sustained improvement in GERD-HRQL after gastric bypass and sleeve gastrectomy. One operation does not fit all. I have no financial or other disclosures. GERD affects 2/3 of the U.S. population. Their quality of life is similar to those with more severe illnesses such as diabetes, cancer, or recent MI. GERD is found in 50 to 70% of patients with obesity, and higher BMI correlates with increased Demeester score. Bariatric surgery may reduce morbidity and mortality from both GERD and obesity-related comorbidities. Gastric bypass has been shown to be an effective treatment for both, and sleeve gastrectomy remains controversial as far as its effect on GERD. Our objective was to determine the effects of gastric bypass and sleeve gastrectomy on GERD-HRQL over time in our own practice, and to determine whether pre-op patient selection impacts GERD outcomes for both procedures. We performed a retrospective analysis of prospectively collected data in 934 bariatric surgery patients between 2014 and 2021. We measured GERD-HRQL scores preoperatively and at 6 and 12 months postoperatively. Baseline GERD-HRQL scores in gastric bypass patients were higher, and they also experienced a greater improvement in those scores at 6 months post-op and sustained at 1 year. The gastric bypass patients are on the left in red, sleeve gastrectomy on the right in blue. You can see the gastric bypass patients' baseline scores were higher with a greater increase that was sustained, whereas there's no significant difference in the sleeve gastrectomy patients' scores. Our study is limited by being a single center with homogeneous surgeon practice patterns. Our data only includes 1 year post-op, which may not capture later symptom changes in GERD. And pairing GERD-HRQL data with additional objective data such as endoscopic findings, PPI use, and pH impedance results would strengthen our findings. In conclusion, gastric bypass is an effective and recommended treatment for both GERD and obesity. We measured sustained improvement in GERD-HRQL scores after Roux-en-Y gastric bypass, and sleeve gastrectomy patients did not significantly have a change or worsen symptoms of GERD. A practice pattern of assessing for GERD preoperatively and tailoring operative choice based on a history of GERD may lead to more favorable post-surgical reflex outcomes for patients. I'd like to thank all of my mentors at the University of Utah Bariatric Surgery Program, especially Dr. Eibel, as well as the SAGES Selection Committee for this opportunity to present.